let's jump right into this explainer. If you've ever gone down the rabbit holes searching for sleep aids or focus music, you know the drill. There are literally thousands of audio terms thrown around, all promising to instantly cure whatever ails you. Today, we're going to untangle how the internet constantly blurs the lines between relaxing sounds and actual clinical care. Which brings us to the core question. Is ASMR the exact same thing as music therapy? Well, this is exactly what doctors and researchers are practically begging you to ask before you use sound for sleep, anxiety, or pain. The distinction between these two? It's absolutely vital for your health, your wellness, and honestly, managing your expectations. Section 1. The sound therapy blur. When every playlist is called therapy. So right now, if you look online, you'll see binaural sound, ASMR, and music therapy all lumped together into one giant wellness bucket. And man, that creates a ton of confusion if you're genuinely looking for help. Here's the absolute crucial point. Sound is powerful, no doubt about it, but not all sound is therapy. Sure, it can totally help with focus or emotional regulation, but labeling any relaxing Spotify playlist as therapy, that completely ignores the actual science. We've got to be incredibly precise about what these tools actually do. Section 2. ASMR, Media for Comfort. The power of self-selected sound. Okay, so what actually is ASMR? Well, it's usually a self-selected sensory experience chosen for calming or pleasant feelings. We're talking triggers like whispering, tapping, maybe page turning, or the sound of rain. If you're a fan of ASMR, you know exactly what I mean. You pick specific triggers just because they feel good to you, which makes it a fantastic self-guided bedtime tool. You're completely in the driver's seat here, picking the media that helps your brain transition from work mode to rest mode. And what's super fascinating is the science behind that feeling. ASMR isn't just all in your head, studies actually show real physical changes. We're talking physiological effects like a lowered heart rate, increased skin conductance, plus better mood and solid sleep support. For folks who get those brain tingles, there's a very real, genuine mix of calm and sensory engagement happening in the body. But, and this is a big but, we have to be perfectly crystal clear here. ASMR is media, it is not a medical treatment plan. There are no clinical assessments, it doesn't adapt based on progress notes, and you aren't getting it from a licensed board-certified therapist. It's media, not medicine. Now that doesn't mean ASMR is worthless, not at all. It just means we need to put it in the correct category. Moving on to Section 3, Music Therapy, Clinical Care, Evidence-Based Interventions. So let's contrast that. According to the American Music Therapy Association, music therapy is the clinical, evidence-based use of music interventions by a credentialed professional within a therapeutic relationship. Notice those key phrases, credentialed professional and therapeutic relationship. The goal here isn't just to chill out. You aren't just throwing on some headphones alone in your room. This work is directly tied to a real clinical need. And the process itself is exactly why it's considered clinical care. It's rigorous. First, there's an assessment, then setting clinical goals, followed by the actual intervention, and finally, evaluation. A music therapist isn't just telling you to hit play on a YouTube video. They're actively monitoring how the intervention is working and pivoting based on actual medical goals. Let's look at how this plays out in the real world. Say you have a stroke patient, their clinical goal might be motor timing, so the intervention would be rhythm work. For a child, the goal might be building communication skills, which could be addressed through singing. Or for a dementia patient, it's all about memory and connection using highly specific, carefully chosen music experiences. In these scenarios, the music isn't just some background decoration. It literally is the medical intervention. Section 4. Media versus medicine. Drawing the boundaries. When we put these two side by side, the boundaries become incredibly obvious. ASMR is all about personal preference, voluntary listening, and zero clinical assessment, just vibes, right? Music therapy, on the flip side, requires that therapeutic relationship, a credentialed professional, and very specific clinical goals. The line in the sand is super sharp here. Music therapy is actual therapy, while ASMR is media. Actually, before we go any further, we really need to acknowledge an important caveat. Sound is not universally relaxing. For folks with a trauma history, tinnitus, migraines, misophonia, sensory sensitivities, or certain neurological symptoms, forcing sound can actually be unsafe. If any sound causes distress, you've got to stop. Turn down the volume, never force yourself to listen, and definitely seek out some professional guidance. Section 5. When to use which. A practical guide for your nervous system. So how do you actually apply all this to your daily habits and sleep routines? Well, ASMR really shines for comfort, winding down, and building those predictable evening routines. Think of it as this gentle, personal support system that kind of sits around the edges of formal care. It's just a wonderful way to give your nervous system a clear cue that the day is ending. It makes your sleep routine feel safer and helps you power down from the daily grind.
That being said, ASMR simply cannot carry the load for things like diagnosed depression or trauma, persistent insomnia, chronic pain, neurological symptoms, or support needs for autism and dementia. If you're dealing with severe or persistent symptoms like those, that is exactly when you need to step away from the self-selected media and seek out formal music therapy or medical care. Sound is powerful for sure, but that power really needs the right clinical context.
There's a takeaway from all of this that I absolutely love. It goes, the best approach is not to turn every pleasant sound into therapy. The best approach is to respect each tool for what it can actually do. I think that just hits the nail on the head. It perfectly illustrates our core message, validating the real comfort you get from ASMR, while deeply respecting the profound clinical power of actual music therapy. So, I'm going to leave you with this question to ponder. Which sound-based support helps you the most? Take a hard look at your own bedtime or stress relief habits today and ask yourself, are you just looking for some media comfort to wind down, or do you have a condition that really requires the clinical care of a trained professional? Understanding that difference is the very first step in properly supporting your mind and body. Thanks for joining me for this explainer, and I hope this helps you navigate the whole world of sound just a little bit.